giving therapeutic touch. So these kind of things could be more easily understood. Yes. Okay. लेकिन उसमें भी ना वो फिर बहुत वाइड और ब्रॉडर कैटेगरी है ना, उसको थोड़ा सा स्पेसिफाई करने के लिए आप उसी के अंदर से एक इंटरवेंशन लिख सकते हैं
हॉस्पिटल से बाहर फिर निकल जाए।
यस सो यस यू हैव पॉइंट ऑन दिस okay what is answer from this group of this question
option A C D E and that's it.
So according to you, there are 4 options. Okay, you are saying 4. So 4 are the answer of this question. But if you are saying your point is very much relevant in this sense, if you are saying there are more correct answers, so then you have to develop more options. Then in list 15 or 20 options, and in that maybe student can get 5 correct answers. Okay, so that is not bound to the amount of that distractors and amount of answers. But if there are more answers, then you have to develop more distractors as well. And that distractor should be homogeneous, not from one from the radiological examination, one from the intervention, one from pharmacology. No, all should be intervention, all should be medical related thing, all should be related to the case scenario. So in this way, you have to think about it.
Best.
Okay, not even a single option should be act as a non-functional distractor. Is it clear? Thank you so much. So now we are, because of shortage of time, we are not taking other groups for presentation. So this is one of the questions that how concept of alignment is related to the particular type of question. Do you have an idea about alignment? What is alignment? To keep it straight, to keep it in line, to keep it in order. Yes, in sequence. So for example, if we are developing case cluster, so what sort of objective or what sort of teaching learning strategy we can adopt for assessing these case clusters? Any idea? आप अगर केस क्लस्टर असेस करना चाह रहे हैं केस क्लस्टर तो पहले आप उसको किस स्ट्रेटजी से पढ़ाएंगे और ऐसे कौन से ऑब्जेक्टिव होंगे जिनको आप उस तरह से असेस करेंगे डिस्कशन स्मॉल ग्रुप एक्टिविटी एनी अदर case study. So case study is one of the most relevant teaching learning strategy you can adopt if you want to assess it through case clusters MCQs. Okay, because that case study in your teaching learning process you are using the case and you are training to your student that this is a way by which you need to assess the case. You will understand the case and then accordingly you are assessing it at the end. Actually what is happening that whatever your learning objective is, what we are starting, we have some learning objective in the class. Okay? Then we are teaching it and we are teaching through multiple teaching learning strategies. Sometimes we are using only PPT, sometimes we are having small groups, sometimes we have PPL, sometimes we are having this blackboard or you are having for especially for the mathematics kind of subjects, and sometimes we are giving individual activity to our student, home assignments. So these all are teaching learning strategy. In a similar manner, we need to see it that how this particular teaching learning strategy is relevant and aligned with the assessment strategy. So these are different assessment strategies that we had discussed now, any kind of MCQs. Okay? So case cluster, EMQ, they are more relevant to the unfolding or simple case studies. Okay? Or any scenario based activity. For example, in the class if you are giving small scenarios for your student, and then you are teaching any kind of disorder or the topic. So you can ask it through EMQ and through case clusters. Is it clear? Okay, next. So these are some of the pathology. We need to see what is the construct irrelevance variance of our question, that how our question look like. Is it clear? Is it relevant? Is it easy? The language is appropriate. We have discussed in our activity that which kind of things we are doing. So sometimes our MCQs is having a threat, and that threat is related to our validity, and that threat is related to our under-representation, content under-representation, which means, for example, if you have 5 systems for asking, cardiology, neurology, or maybe pulmonology, and then renal system, so out of these 4, you are asking, and if the total number of questions is 50, so if you are asking 30% from cardiology and 20% from other content, is it okay? No, because you are asking lot of questions from the cardiology and very minimal questions from other 3 domains. So that means content under representation. Okay? If you have 4 topics, so you don't need to divide your MCQ's number with that topic, and accordingly you give the paper. Okay? It does not mean that you will ask more from one component and very few questions, or maybe one question, or you are not asking any question from any other topic. So that means content representation. Is it clear? Okay, next. So some of the flaws and errors, and we have discussed that things in our activity. Yes, next. These are the errors and problems which we are observing in our MCQs, and we have discussed it. As you people have done this activity, you make a scenario and there is a grammatical error, there is a language error. For example, there is a non-functional distractor, or maybe there is a very long answer, or maybe some of the terminology which is written in the scenario as well, and that is given in the distractor as well. Okay? So word repeat comes under that. And we are not using none of above, all of above, and some sort of tricky or some sort of clue in our scenario. That is again one of the flaw or error. Next. So we need to manage these pathologies by, yes, by our blueprinting. Blueprinting, that is a task. As I already mentioned, if you have 5 topics, and you want to develop 50 questions, so 10 from each. Okay, so there would not be any underrepresentation of the content. And you need to train your faculty. Faculty training is a major requirement for student assessment. If your faculty is not trained and they are not known about it, how to develop a quality MCQ, so definitely we would not expect from our student to do it perfectly. Okay? So, in this regard, development of faculty and then again development of MCQs. For example, I developed a question, I need to give my colleague for review. She will review it and she can comment on it. Then exactly, and then we have subject expert. For example, someone is teaching the research and he is teaching from previous many years. So definitely he is the subject expert. For example, I can keep only the standalone, or I can keep the case cluster in my paper, or I can keep the EMQ in my paper. So the example in STMU which we are utilizing the standalone and case cluster both. So for example, if I am teaching the pathophysiology and nursing, so we have both subjects. I am using this case. So refer this scenario. Multiple questions with that. So that is our guideline, which is telling us, and this is our guideline that which is for distractor, and that only one should be the answer. Okay. In the similar manner, this is one of the guidelines that I have to develop 4 distractor, not 3, not 5. Okay? And one of the instruction or one of the guidelines could be that 20% from the recall level and all other should be at the other level. For example, from the comprehension and from analysis from application. So this is basically the guideline that university or institution should provide to the teacher that your paper should be look like this kind of. You should follow these guidelines. Is it clear? Next. So, thank you so much for attending and bearing us for a lot of time. I think we and Sonia are hopeful that we shape your brain very effectively and we try our level best to stimulate your thinking and develop some of the questioning. And this is an area where all of us are in the similar manner. No one is lower, no one is higher. We all are in learning phase and we learn a lot. You people have learned a lot from us and we are also learning from you as well. So we are giving you few minutes for reflection about this session, how you find it and what you have learned from this session. Anyone?
First of all, I have a question for the clarification or for my information. That is there any specific guideline from an institute or like from university or that we follow that for specific guideline?
Each university or institution is having their own guideline. For example, as I am talking about the STMU guideline, that we are taking that, and when our teacher is new in our setting, so we are trying to help that teacher to get a training workshop of MCQs development. And after that, we are having a system that once the teacher develops the paper, so that teacher's paper is evaluated by the coordinator. So we are guiding in this manner as well. We are giving feedback to the teacher that these are the things you need to follow next time or these are points. And we have one-pager guideline for MCQ development in our exam department, which is circulated before the examination, before each examination. So in the similar manner, different institutions are having their own different guidelines and policies and procedures. So definitely they are, whatever your institution you have to follow that. Yes. Okay, 1 minute please. Any other comment or question from audience?
सबसे पहले तो थैंकफुल है आपके इतना अच्छा और बहुत इंफॉर्मेटिव हमें पता लगता है कि हम कहाँ खड़े हैं मेरा यानी 10 years का एक्सपीरियंस है और इतने टाइम से हम बना रहे हैं इंस्टीट्यूट और हमने कोई परफॉर्मेंस बनाया मगर बहुत ही इंफॉर्मेटिव और बहुत ही अच्छा और शॉर्ट टाइम में आपने बहुत कुछ बताया है तो थैंकफुल है आपके बहुत और बहुत होप करते हैं कि आने वाले टाइम में आप फिर हमें बुलाएंगे इस तरह के प्रोग्राम थैंक यू वेरी मच
You are more than welcome. Okay, any other?
मेरा क्वेश्चन ये है कि इससे एडवांस लेवल पे क्या कोई ऐसे स्ट्रेटजीज है कि हम जा सकते हैं आगे कोई रास्ता है?
Yes, definitely. We have other kind of questioning as well. So currently we are not following the type of questioning which are more advanced as compared to the standalone case classes, and we can adopt that. So if we get mastery on these kind of levels, so definitely we will move forward and we will learn that. Okay. Any other?
मैम मेरा भी ये हमसे सवाल है कि ये इस टाइप के MCQ जिन चीज़ों के ऑब्जेक्शन है और जो चीज़ें कर रहे हैं हम लोग एग्री डिसएग्री ऑल ऑफ मतलब इस चीज़ की चीज़ें जिसमें नहीं है तो क्या ये इंटरनेशनल लेवल पे ये कर दिया है कि ये सारे करेंगे अभी स्पेसिफिक कुछ इंस्टीट्यूट ये भी कुछ करा रहे हैं यानी आपने तो अपना बताया कि शिफा इंटरनेशनल इसको फॉलो किया इस पर वर्कअप हो रहा है और बाकी लोगों को भी स्प्रेड किया कि वो जब अपने इंस्टीट्यूट में जाके इसके वर्कअप करें लोगों को इंकरेज करें नॉलेज दें लेकिन ये मतलब ऑफिशियली इस पर वो है कि सब लोग इसके लिए फोकस करें
Okay. If I would say that internationally or nationally, so in that regard I would recommend, I would say that Yes, nationally we are not very much developed up till now in nursing field, that we are in different institutions, policies and procedures are different. But while looking at the quality, people are trying to adopt it. And many institutions are now in this phase that they are doing their faculty practices, they are doing their faculty training, and they are doing some sort of other workshop and seminars and these kind of things to train their people to having this. And slowly and gradually, when they have enough trained people, so definitely this could be applicable in each schools or in each college. But at this point in time, I would not say that everyone is following this. But if you are looking at your own art in this manner, they are not having all of above, these are above, because most of the guidelines are applicable in NCLEX exam. So internationally we can say that yes, people are adopting it, but nationally we are not very much developed up till now. You saying you had one.
Thank you so much that today's session was very interesting and we learned a lot from this workshop. So for the future workshop, I have just one suggestion that for the MCQs workshop, we must include paper specification because it is related, well related with the MCQs. Because we need that what is paper specification and how we make them, and which is important, then we can move to the next.
This is very relevant point. Yes, before moving to the MCQ, there should be a one workshop for the task development. Okay, any other comments? Yes.
Thank you so much, ma'am. It is really